diseases, but there's about 36%, that's estimated, the American Academy of Pediatrics estimates about 36% of the people in the United States have spent a lot of time during the last couple of years in a zone where ozone was above the recommended levels. And so 36% of the population last year were in areas that failed to meet those national standards, those federal standards for ozone layers. So when you see that and you know that there are all these children that have asthma, and we've seen an increase in asthma anyway, that it's only going to be worse. We've seen this change, we think. We've seen this change in seasonality, and so there's a longer pollen season. There is a longer time for people to be exposed to those things that cause asthma. And so that's going to be one of the things that we're going to see. The other thing for me that was unusual, I'm a guy from Oklahoma that comes down to Miami.
They're very vulnerable. They also don't have the ability to adjust their temperature. The other extreme, elderly, also more vulnerable. And then we look at poor people. And in our communities right now, poor people are mainly Black and Hispanics. All the data shows poor people live closer to coal power plants, to pollution, to those Mount Trashmores, those dumps. Poorer communities are much more vulnerable. Dade County is filled with poor people, especially Miami. You don't know if you guys, we saw it when we live here, we don't remember the farm community. And again, I work at Jackson, so my homestead people will have to come to me because they're undocumented, uninsured. Mm-hmm. And there I see my farm communities who the renal impact because they're out. Farm workers are paid by piece, they're not paid hourly. So if they stop working, they don't get paid, so they don't stop. So their kidneys are affected by the heat. So we're seeing the vulnerable groups. We all know this. We've seen this time and time again. Poor people are our canary in the coal mine. It will impact us eventually, all of us, at some level, but the poorer folks will see it more. All my patients I see are poor, so that's why I'm much more aware than other folks who may not get it till the storm comes and the storm hits. Mm-hmm. But the little day-to-day impact, the poor people are most vulnerable, and Black folks, because of the history, we're seeing it. 1 in 9 African American has asthma. So when we talk about allergies and pollen count and pollution, we're talking about impacting a group that already has a disease disproportionately than the rest of the community. 1 in 7 Hispanics, and only about not only, still bad, 1 in 14 whites, and we know it's going to get worse. So yeah, we know this. It's just, what are we going to do?
If I can add a little bit to that, there's also more subtle things that we need to consider in terms of the forces of systemic oppression. Only the fact that in poor communities you have less access to green spaces, to organic food. In Puerto Rico, when we suffered from Hurricane Maria, it was incredible. One of the biggest problems was that every food that we get pretty much comes from the imported ships that come from Jacksonville in Florida. And once you have an island that doesn't have access to that, and that every ship needs to come from Jacksonville because of a law that inhibits the ability of ships to come from other places to help and provide assistance, which is the Jones Act, then you have a compounded effect in terms of the effect of the hurricane, which has been proven to be influenced in terms of severity and frequency by climate change. So then the extent of the impact becomes bigger. And unfortunately, the communities that suffer it the most are usually underserved, previously displaced populations that were relocated into the areas that they live now because of other situations of civil conflict and also climate change related events. And then those are the people that are gonna be again displaced, sometimes from the land that was originally there, when you think about Native Americans. So there's an ethical and moral component to this that I think that needs more attention. In terms of the extreme weather events, there's a lot of changes in terms of sleep habits, increased domestic violence rates. Sometimes families struggle with the dealing with an extreme weather event is like grieving. So we basically go through the different stages of grief, and sometimes, when we're going through the despair or the anger stages, that can cause a lot of problems in Puerto Rico. And here, when there's a hurricane, what took you 30 minutes to get to your job might take you 4 hours, or you might not even be able to take your car out because there's trees all around that you can't get rid of. And that happens sometimes in big hurricanes, category 5, like what they showed this morning, for a long time. So that will impair your capacity to, to get money, to have your family survive, et cetera, et cetera. So that has a chain event of things that impact health.
Thank you. Do you want to add anything, Dr.?
No, I think that the heat issue is obviously, certainly, it absolutely impacts the poor more than it does. My friends in Coral Gables go inside the house when it gets hot in the afternoon. My friends downtown that may not have that access, not only do they live in a place that may not have access to air conditioning, because to escape the heat, they may be outside more, exposing themselves to other illness by being outside, especially if we start talking about these vector issues. And simply being in an urban area actually creates this island of heat that occurs in the cities with the lack of green, the lack of ability for the city itself to cool. And so it just becomes a terrible problem. And we also, we can't just look at here, again, when we talk about climate change globally. 2015, with those heat waves that everybody was talking about, we kind of forgot that pretty quick. There were a lot of people that died in Iraq and Iran. There was, in Iraq, there was a day where the heat index was at 165. I mean, how can that possibly be? And then, in Germany, in those towns that you expect the temperature to always be in the low 80s, whatever, it was 104.5. There were people that died, people that kind of live and act like we do that died there. We can't forget that. In India that same year, there were almost 2,500 people that died of heat-related illness in just a short period of time. So this is an impact around the world. It's a medical impact, not only behavior, but kills people. It's a morbidity mortality problem.
And I appreciate you bringing the scope back out, because although we're talking about this subject as a South Florida resident, it's clear as day that this is an entire issue for the globe that we need to be working towards. And as clinicians, I would like for you to touch a little bit about these vector diseases you mentioned, just to give a concept in case anyone in here doesn't know, and then we'll continue.
So the idea here of China, that we didn't expect that to happen. We see Salmonella and Shigella, these enteric diseases that you get that cause diarrhea. We're seeing that because of some of the changes that are happening with water and the temperature. The higher the temperature, these bacteria and some of the viral illnesses seem to do better in those warmer temperatures. The mosquito themselves can live longer, and it can reduce the amount of time it takes to produce the virus that cause these diseases. So there's a lot of factors that go in there, but this is going to be one of the next global epidemics if we don't get control of this problem. And we are so arrogant that we think that we can handle all this, that man can't change his destiny when it comes to infectious diseases. Go back and ask the people, look back at the people when plague wasn't in Eastern or Western Europe, and man came in there, we kind of started traveling around, and we got these diseases that killed millions of people. It goes all through time. We're very arrogant if we think this couldn't happen to us.
And that's a great segue to talk about control, right? So what, as clinicians, are your either actions that you've done, planning to do, encourage others?
Mm-hmm. It bites daytime, nighttime, all the time. It's not the dusk and dawn mosquito. So that's the problem that we face with this mosquito. So everyone, and as the range rises, and it's going to be pretty much North Carolina and above in another few years, but it's definitely Florida. So this is wherever you live matters. So it's not just going to be in Overtown. It's not just going to be Wynwood. They grow and live everywhere. So we're all impacted by this Aedes aegypti mosquito. And this season, the mosquito season has grown. It used to be only like 300 some days. Now it's like 320 something. It's like the whole year practically. So we are facing in Florida that whole impact of the Aedes aegypti. And we have to figure out what we're going to do. And so our question was, what do we do?
What do we do?
Yeah. So for me, I'm also a PSR doc, and many of the doctors are in PSR who have been much more aware of this. And I work with the Black Physicians, the National Medical Association. And as Black physicians, Katrina, pretty much everything. We take care of poor Black folks who are always out there. So we became much more involved and aware of this over 4 or 5 years ago. Even though PSR has been out there forever screaming and yelling, until it sometimes hits you, you don't really wake up. And for many of our physicians, we are waking up. And so despite PSR, we didn't see the climate literacy there for physicians. It's not taught in medical schools. It's not even taught in public schools. And if you listen to LRN, they just did a poll. Most parents wanted climate change to be taught in schools, but it's not being done. Most medical students want it to be taught, but it's not being done. Most physicians are aware, but we don't have the data and the importance, so we don't know how does it really impact, how do we collect data. So that's why we are becoming much more involved in the Florida Clinicians, that targets clinicians.
When there's a risk of floods, when there's a risk of an extreme heat wave, getting the information out there. When we work with underserved populations, a lot of these folks are not reading the newspaper. They don't have time for that. They're in survival mode. They're trying to find food for the day. They're trying to find some shelter just to survive, and they sometimes are not in the mental state to know what's coming and prepare for it. So offering something like a kit, telling them that the shelters are going to open to a higher capacity, which most nonprofits tend to do when a hurricane, for example, is coming, is a big part of our jobs. Also thinking about my actual clinical job, when I work with people that take certain medications like antipsychotics, that actually exposes them to less tolerance to heat. So educating them about the side effects of the medications and how climate change can make those worse is very important, right? So we have to think about that and have a safety net network and wraparound services to deal with all of those effects of climate change on their health.
So I think that's a lot of information, but it's a lot of call to action on clinicians and people who are not in that field as well. So that sounds like volunteering, that sounds like being educated, joining CLEO, joining all of these nonprofits and becoming more educated so that you can share awareness. And that's how I'm at this table, is by educating, sharing awareness, and understanding that our health and the population, the earth, a healthy earth is healthy people, healthy earth. It's all together. So all of us have these testimonies that really tie into how do we live healthy together. And I know that Dr. Biehler has a story about fracking, and I wanted
If we have my pictures, I'd like to kind of answer this question, but with a little bit of story. I come from Oklahoma. We do testimony a lot in church. You know what that means? Yeah. Okay. So we don't have the slides?
No, I thought the slides were for the afternoon.
Okay.
You're just gonna have to use your words and paint a picture.
So the slides are.
Come to the afternoon session.
Okay,
we can go further into
so
this concept.
For me, one of the things that happened in my life was that I have two sons, and one of them was destined to inherit the family farm that's been there since the land run, in our family since the land run of 1889, when not me, but somebody took it away from the Native Americans as if they owned it. But it's been in our family since then. The other son, the younger son, was really without a farm, and so I went out and bought a new farm. And it's a pristine farm. The deed to the farm was signed by Theodore Roosevelt, and we have that original deed, and we're proud of it. The barn that's there is about half a mile from the local high school out in the middle of rural Oklahoma. And my father always joked that about half the children in the community were probably born, or not born, but probably conceived in that barn because it's so close to the local high school. And it's beautiful, and it grows the winter red wheat that you probably ate this morning in your bagel and your bread, and you'll eat tonight and for the rest of the week. We love that farm, but about 10 years ago, I was notified by the Corporation Commission that I didn't own the mineral rights underneath it. And it's a long story, I won't go into it, but I don't own the mineral rights underneath it. And they decided they were going to drill an oil well on my farm. We were almost to the point where we were going to reach organic status, right, with no pesticides, but now we had an oil well. When we researched it more, we found out that they were going to dig a deep oil well and frack the oil well, and it was going to be a well that had at least 4 heads on it, so they were going to go down and do this. So I hired a lawyer, as all good Miami people do, right? And the lawyer told me that he would spend all the money that I could give him, but I was going to go broke because we weren't turkey. We have quail everywhere, and it's beautiful. But after they did the drilling and the fracking, their fault that it was always sandy in that area, it doesn't grow wheat. Okay, well, it certainly doesn't grow anything now. But the biggest thing that happened, and so the entire farm has problems. You know, one of the things people don't realize when you frack in local areas is that there are thousands of trucks that drive by, and like hundreds per hour trucks that drive by because they got to get rid of this horrible fluid that's all coming out of the ground. And so for that reason, you've got dust pollution that kills everything within 100 feet, more than that, of each side of the road because there's dust and dirt everywhere. So now all that's happened. It just looks awful. But the heartbreaking thing is my sons, who I'm extremely proud of, one of them does, environment stuff. His degree was in environmental sciences. And my wife told me, my wife who's a wonderful person, a good mother, said that the one thing about our farm is that she would never let our children eat or drink or fish or play on our own farm. So, excuse me, I'm sorry. But that really, really motivated me to become an environmental activist. So anyway, that's my story.
Thanks for sharing that. So I wanted to add to that in terms of taking action, and I don't think this applies to just physicians. It applies to probably everybody in the room. Besides just staying within the realms of what we do in our careers or our professions, we just need to get political. I'm not talking about partisan politics. I'm talking about mixing the science and the data that we have and going beyond and putting the information out there in a way that's palatable to the public and that influences political decisions. And we are not doing nearly enough of that. One of the things that I shared with Dr. Holder was an event where we actually went to Congress to talk to different legislators to advocate for certain policies or certain procedures that we think that they need to take to protect the health of our citizens. And they have constituents to represent. So we have to take the time to do that, and it's very draining. So one of the other things that we focus on when we provide community support is also addressing the psychological aspects of doing this work. We're all at higher risk just as first responders. So we have to take care of ourselves and also find time for that. So balancing things out, training people on how to make sure that they avoid burnout is very important. And then working on avoiding our own, which has already happened to me, and I'm sure that a lot of people here. We need to influence policy. So sometimes that could be going to a march, like Dr. Biehler said, putting your white coat on and saying that you're a physician and that you defend the cause has a big impact. So things like that. I wanted to add that.
I would want to say one thing now that I got myself back together again, is that, yeah, it's okay, is that sometimes I think that, that I don't do enough. I know I don't do enough. My sons ask me all the time, what are you willing to do? And what are you willing to do? And sure, I'm willing to say that we should educate, and I think that we should educate, but I'm not so convinced that all the things that I do right now, including all those green things that I do around my house and that I try to support and all those things, I'm not sure it's enough. I'm not sure it's not a time for a call to action that's extreme. And I'm not extreme, something awful, but it's almost time to say that if we don't do something right now, it's going to be way too late. And as a pediatrician, I owe it to my patients to do something right now. And so my sons ask me, what are you willing to do? Are you willing to go to Washington and tell people that we can't just put up a solar panel in our house and think that we're going to change the environment? We got to stop this stuff that's killing the environment. We got to do it with force and with some anger, and we got to do it now. We can't wait. We can't wait and let our kids do it. We just can't.
I want to add something to that, and this is personal. I'm not going to tell you something now that represents my profession, my department, nothing. This is a personal opinion. In order for us to really do that, we have to be very serious about changing paradigms. Unrestricted, unregulated capitalism is not sustainable. And just being here with our lights on, with an AC on, buying clothes that we use for a year and then we throw away, having the SUV that they were talking about earlier, which I have for different reasons and I feel ashamed of, it's just not sustainable. We can do a lot with not using plastic water bottles, cutting down, but it takes policy and public efforts to really change unregulated capitalism, and that's my personal opinion, but I think it needs to be said.
I agree. I'm going to take one more second again, when you go out to rural Oklahoma and you see these oil wells and this consumption of petroleum products that take place, it's really, really terrible for your own mind. When you see thousands of 10-inch pipes that are 100 feet in the air that are burning off methane 24 hours a day, 7 days a week. And it's more methane being burned than you could ever imagine you ever consuming in a lifetime or in a city of Miami lifetime. Again, I think we've come to the point where, as much as I want to say that we educate everybody, we do all these things, it's time that we have to stop with this consumption of the oil, the petroleum products, and we have to make our government, no matter what the cost, no matter what it takes, we have to stop it right now. We just have to stop it.
Being down with the folks, many of the patients I treat in the community aren't even aware of the level in that, how to connect the dots. And what I hope is, especially, is how do we reach the young people? And I think, to me, that's what's driving the Republican Party, because they've seen the demographics, and their young people are not supporting them, and they all want to keep their jobs. But how do we as a community reach our young people? Because as much as we speak, the impact is really going to be more for our children and our grandchildren. We're getting some now, but we're talking about 20 years. So if we can't get our kids, that's why I'm so proud of the folks in Europe, those 15-year-old and those kids who are speaking out. And what can we do in our society? I have a son also who came up with a Connect to 5 idea, which is each of us just find 5 people engaged in conversation. And each of us find those 5 people and make some action plan. If it is simply straws or whatever it is, but we've got to look at policy. The fracking bill was not passed, that was just come up in Florida, but they are going to allow fracking in Florida. They already approved it in Broward, and they supposedly said it was the ban on fracking wasn't comprehensive enough why they didn't vote for it. So there is no ban that made it through. So fracking is going to continue in Florida, Broward County. They're voting to take away the county's rights and city's rights to keep it central in Tallahassee, so we can't do bans on plastic bags. We can't ban the substance in the sunscreen. That is totally bogus when they say we're going to ban sunscreens. There are 2 substances that we know could be eliminated and still have effective sunscreen and save our coral reefs. But Tallahassee is now moving towards stopping county and city rights. This is a state that talks about state rights, but somehow for your counties and cities, they can't have their rights. So we have to learn policy. We have to figure out how to bring it into our families and how to take the politics out of it, because we're talking about our children.
So with all of that, there's so much information, but because we have about 20 minutes, we really want to open the discussion up for anyone on the floor, because we want it to be interactive. Perfect. Hands are up. So I saw the first hand go up was over there.
Yes, hold on. I got the mic. I'm right here.
Thanks. Hi, thank you for being here with us this morning. My name's Steve Eisenberg. I'm an attorney in town. I've been reading a lot about factory farming and how factory farming impacts the health of the people in the country, but particularly those who live around it. We certainly have those in Florida. And there tend to be poorer communities around factory farms. Can you talk a little bit about if you have experience with factory farming and its impact on health?
Go ahead.
Well, I don't really know it in terms of factory farm. I know the workers who are involved, and many of the black communities, especially when you're in the central Florida area, western part of Florida, we are seeing the pollution, the asthma, the other complaints. Now, unfortunately, this is where we say physicians having the climate literacy and understanding, we don't collect the data correctly. So if that patient came in with a rash or an asthma, we're not going to link it that they work on the farm or this area. You'll just see asthma exacerbation, whatever code that is, and then it's moved on. So we know the impact is there, but how do we prove it? And that's really one of the challenges that we face in how to prove it. The chemicals, especially like chemicals and fracking, is proprietary. So there is no release of the information on what chemicals are used to frack. So many of the chemicals that are used and the pollutants that are there, we're not really aware of, so we can then link it. So that's part of the problem.
And health impacts of these kind of changes in society are so far-reaching. Sometimes it's difficult to get your hands around them. You know, some of the practices in other states like this have resulted in things that you wouldn't think about, in increasing homelessness. You think, well, how could industrial changes that take place in rural America affect homelessness in those areas? It's because if you bring in a large industrial group that take up the homes that are available, you suddenly have this impact on children with homelessness. The same kind of thing happens with weird things you wouldn't expect, like you can see changes in sexually transmitted diseases that occur because of the change in the population. So, again, it's the far-reaching things. And of course, my side always is going to fall on the people that are the most vulnerable, and it's going to be the children and the poor.
Thank you.
Also with factory farming, there might be alterations to the soil, you know, to the space where people live, and that can bring diseases in terms of how they're eating, you know, when you see poultry that's caged, you know, and other animals that we eat that are caged, there are certain risks in terms of pollutants in that food that we're consuming, so that might also be related to your question.
My name is Bernard Horowitz. Several of you talked about especially vulnerable communities and how you're involved in education and otherwise helping. Can you tell us some success stories that have come from that, not just the difficulties in dealing with it? Thank you.
I actually was thinking about that this morning on focusing more on solutions, and then we didn't. So I have some success stories. By trying to figure out how in the nonprofit organization that I mentioned, which is called Crear con Salud, Create with Health in English, we went through a couple of hardship in terms of trying to figure out how to help after Hurricane Maria. And we looked at the literature related to, psychological first aid and all of that, the responses after disasters and all of that. But we finally realized through previous activities and connections that we had that the best way that we were going to be able to help was first ask the people that are struggling with the problem what they need. And they know what they need. And sometimes, very often, I would say most of the time, they don't really get their voices heard. So through the excuse of mental health and providing this through the health perspective, people are more open to listen. And if you empower them, you help them empower with the support that you're giving them so that they have the forum to speak up. And they work on projects to unite the communities that they're at and to demand action from the government, in this case, to actually get the income and the resources to actually recover from the hurricane. That empowers them because it's coming from a clinician, from a professional that's helping them with their mental health. But remembering that we are not there for charity or philanthropy. We're there to help them with the resources that we have, to empower themselves and demand for what they need, and then to get together and take action. So in terms of the mental health, I think that the aspect of resilience and what we call self-gestion, and in Spanish is autogestión, because resilience falls too short in my opinion. I'm going to talk more about that in the afternoon, but it's basically for the psychological aspect of empowerment. There's been wonderful stories in Puerto Rico with people that have been without power and sometimes without water for over 1 year, that have come together, have found funds to get solar power into whole communities, to work with farming and sustainable farming projects so that when the next hurricane comes, they have their own food and they don't have to wait for the boats from Jacksonville. And we are part of that in terms of giving the community leaders the support to deal with that psychologically. So that's a pretty big success story that I
can tell you for locally, a group, I think she's going to be one of the speakers, Valencia Gunder.
Yeah, she will in our climate justice.
Right. After one of the storms, one of the issues of poor people, it sounds great, go buy water, go get food, you got to take all this stuff to the shelter. If you don't have money, how are you going to prepare for a storm if you've already used your limited resources? So it's very difficult for poor people to say, I'm going to go to the shelter, I have no food and water to take with me, I have no resources, how do I get there because I don't have a car? So what they've done is develop centers in the poorer communities that will have the resources there. And so they're developed where they have, you can go to these places, you can get emotional support, you can get the water, you can get the resources, you can help prepare in the community before and after, because it's impossible to go by when you have no resources. That model has been supported now. There's a big resiliency group that has millions and millions of dollars in the community, in all the counties, that has been spending a lot of it on raising our roads and building and bringing in more sand. So some of those dollars will continue to support the community action where you have to help the community prepare for the hurricane disaster. You got to prepare after disaster. And what that preparation looks like is very different from rich and middle income communities. And that came out of the efforts of the Valencia Gunders organization, the Florida majority, and that's been an incredible model. There are more models that are coming out from the building up from the communities that we hope to really replicate. I think the clinicians coming together, even though PSR, but recognizing that we have this need, has been pretty successful. And there are dollars coming from the federal government and from private foundations that are coming to address climate action. So I see that as a lot of success on a bigger scale, and then what each little community is doing, being empowered, has really been amazing.
If I can quickly add something to that, it's also, crises sometimes are necessary as an opportunity for change, right? They can be transformational catalysts. So I have a few memories of some success stories that have happened around warnings, like with Hurricane Irma, in terms of having a better access to opportunities for at least temporary shelter with some of the patients that I was seeing at the time that were experiencing homelessness, and then having maybe some extra funding or opportunity to actually get them to some transitional housing program. They sometimes have a lot of difficulty with associating with healthcare providers and people in agencies because they've been through so much isolation, so much rejection from society, right? So sometimes working with health workers and people that go out to them every day. We had a team, for example, that goes out to them that was temporary funded. That kind of program that gets out of the office again and out of the hospital is really rewarding. And I have a few stories of patients that we've been able to house permanently due to things like that. So if we had expanded Medicaid at least, for example, in New York, where I trained for a year, there were a lot of programs that housed mentally ill persons long-term that we had funds for, and we had also programs called assertive community treatment models where people with severe and persistent mental illness get the help brought to them. So you have a team of social workers, substance abuse counselors, psychiatrists, nurses that go out to find the patients and provide them the help, because they're not always going to be in the mental state to do everything that they have to do to survive in a hurricane, to get water, get food.